Hey folks, thank you for joining us here on this third episode of Common Ground. My name is Jeff Morris, your host and chair of the Craighead County Republican Committee. Today we have Representative Dan Sullivan with us, and we'll be talking campus free speech, medical scope of practice, and much more. Let's get to it. Dan, good to see you today, and thank you for joining us here on Common Ground. So today, I just want to talk a little bit about last week in the state legislature and talk a little bit about coming up in this week's legislature. So if you don't mind, give us a little rundown of what happened last week.
Sure, Jeff. We had a really big week last week. Several big pieces of legislation passed. One that I ran was the Free Speech on Campus bill. I think many people know, especially here in Craighead County, that Arkansas State is being sued currently for, I think, about $30,000 because of their current policy on free speech. That current policy, Jeff, allows or has the university set up what they call free speech zones. So a student or a guest who wanted to come on campus would apply for to come on campus and speak. Then they would place you and your materials in a space, a set up area, and you were not allowed to get out of that area. And of course, we had one of our ASU students who's a member of the Arkansas State College Republicans set up with a group to hand out flyers and leaflets. They got out of their space. Fortunately for them, they got out of their space and they were asked to leave campus. That resulted in a lawsuit, and it's again ongoing. And after that happened, Maria and I, my wife and I, had worked with the College Republicans several times, and we talked to them about what the options they had. They filed the lawsuit. Ashlyn Hoggard filed that, and it's very brave of Ashlyn, way to go. And then I met with the Arkansas State leadership, and Arkansas State really was very willing to come together and change their policy. And they asked us as legislators to actually draft the law first so that they could then draft a policy that complied with the law. They were concerned that if they drafted a new free speech policy and the law was different, they'd just have to go back and draft another one. So the leadership at ASU came to me and others I know and worked with us over the course of months to draft a bill that gets rid of those free speech zones. And you know, Jeff, it's really tough and difficult how do you balance on a college campus the willingness and desire for people to have their constitutional free speech rights and balance that with disruptions that may come about on campus. And of course, you have the left and the right both have positions on that, and unfortunately, the right has kind of been at the losing end of that on many instances. But this bill goes a long way to, and of course it's only for public colleges, doesn't apply to private colleges, but it gets rid of those free speech zones anywhere on the campus now. The grassy zones out in front of buildings allows one to truly exercise their free speech. And it does have protections for places like athletic events and closed-in events, classrooms. It does protect against disruptions there. This bill also allows for counter demonstrations. So if someone comes on our campus to speak, and you've seen counter demonstrations happen mostly from the left, but this bill allows for those counter demonstrations as long as they're not disruptive. It also allows for legal relief if someone feels like they are being legally harassed. You know, there are legal definitions for harassment. There are legal definitions for threats. So again, I think that builds a really good balance between exercising your necessary free speech on campus, your First Amendment right, and also allowing the university to have some of the control they need. Fortunately, when we worked on the bill, we had lawyers from the left and the right. We had all the universities in Arkansas meeting with us and talking with us. There were probably about 4 or 5 drafts of this bill initially. We all got together and ended up with one bill. And I just really appreciated working with my fellow legislators, Bob Ballinger, Kim Hammer, Mary Bentley, Trent Garner, just a number, and of course our local representatives right here, all working together on that legislation. I think we had a really good bill. and it passed, I think, with 76 votes. So it was really a big win for us.
That's great.
Appreciate that. And I guess the other one that everybody followed closely was Brant Smith's gun resolution affirming the right of the citizens of Arkansas to open carry. Folks, this is a big deal. We have currently a court decision affirming your Second Amendment right. In the last few weeks, I've met with a number of people, particularly from Act 746 group. They also have the Freedom Coalition. And I'd encourage all of the people that watch this to look those two organizations up, because as I've participated with those groups, it's the closest I've been to being back when our Constitution was written, when people actually sit around the room and talk about the Constitution. They talk about your rights to liberty. They talk about your rights for freedom. And they're just wonderful conversations. They're also really getting engaged in politics. So when a bill is heard, like Brant's bill, people actually came to the Capitol. They looked their legislators in the eye and said, "Here's where we are," and they testified at those sessions, and they testified knowledgeably. They testified about your rights under the Constitution and what you can do. Let's see, we think we had the Right to Life bill also come up.
Hey, real quick, just going
Sure.
back to Brent's gun resolution. So I've had a couple comments on folks asking, well, so how does this impact the concealed carry law that we have here, or not necessarily the law, but in the state of Arkansas, state police offer a concealed carry class that you have to go through to get a permit through them. So how does this resolution affect things like that?
Sure. In our position, meaning the legislators who voted for Brant's resolution, our position is that there's no need for a concealed carry license in the state of Arkansas anymore. That you can carry openly, you can carry concealed, and in the state, within our state borders, there's no need for additional legislation. And that's essentially what Brant's resolution did, was affirm the court's decision. Of course, there may be other court positions or court decisions that come down that influence what law enforcement does and how law enforcement reacts. But this was a big step in a very positive direction to affirm your Second Amendment rights of all the citizens in the state of Arkansas.
Sure. Well, I mean, from a number of constituents here, of course, it's always good to get some clarification there because, of course, the Attorney General came out with an opinion, the Governor issued an opinion, and several other folks have. But, we've just never really had that clarification here. So,
well, our prosecuting attorney here in Craighead County has come out with a written position on that, and they're not taking anybody to court. They're not prosecuting anybody in Craighead County over that. So we're really fortunate here in Craighead County, I think, in lots of ways. It's a very strong conservative county. And our courts, our sheriffs, our law enforcement are doing a really good job on our Second Amendment rights to recognize what our Constitution allows.
Absolutely. So let's going back to that right to life thing. I didn't mean to cut you off there,
right.
But so over the last couple of weeks, whenever we had last week we had Brant, the week before we had Senator John Cooper with us, and of course this whole right to life conversation has really been a hot topic lately with legislation passed in states like New York and Virginia and others. So tell us a little bit about what our abortion law now states and what this legislation will do to change it.
Well, we had several right to life issues come up. This one again just affirms. You hear a lot about Arkansas being 48th, Arkansas being 49th, Arkansas being, wherever we are.
Aren't you tired of hearing that?
Aren't you tired? And I so appreciate it. Yeah. Jack, I hope you're listening, but Jack Ladyman got up in front of the legislature this week and just helped remind us that Arkansas is tops in the nation in several things.
Sure.
Recognizing liberty, recognizing our right to life, number one. And we have several bills that have come out affirming that position on life. But Arkansans can be, and the Craighead County Republican Committee can be proud of being the leader in the state, and we can be proud of being the leader in the nation when it comes to standing up for one's right to life. And I guess there's a lot of things we can be 48 and 49, but folks, I tell you what, when you're number one for life, and you're number one for Second Amendment, and you're number one for speech, everything else kind of trails off when you look at that. Because we can achieve all those other things when you stand for life, when you stand for that Second Amendment right, you stand for free speech. Those are what our Constitution, that's the foundation for our government. So I think all the other things will come along. I know I kind of dodged your question.
No, that's
a little
all right.
bit,
No,
but
no.
again, I have a hard time. We're either number 2 or 3 in the nation in right to life. We had a bill similarly that went through this recently that has these safe haven baby boxes. I don't know if your watchers kept up with that, but there are people that are choosing life, but they have a place now if they want to give their baby up for adoption anonymously, where they can do that in a very safe way. And we'll be installing these safe haven baby boxes around the state to protect life and stand for life. So again, if the next time someone comes to you and says Arkansas is 48th, Arkansas is 49th, remind them what we're number one in. We're number one for life. That may be one of the most important things. It is one of the most important things we have. And I'll make this final comment. Folks, I'm really concerned about our leadership in our churches. And coming from the pulpit, and our ministers in our churches not speaking directly to this point. The blood of the babies in New York and Massachusetts and Virginia and these places that are passing these abortion laws, even allowing murder of a baby after it's born, the pastors in our pulpits need to step up.
Amen.
They need to wring that from the pulpit. We ought to be praying about those kinds of things. And I would encourage you to shoot your minister a text, hand them an email. When you're walking out the door and shaking their hand, ask them if they would please bring this up. We people can't change people's minds sometimes, and I'm guilty of trying too hard to change your mind or somebody else's, and they're all as hard-headed as I am. The Lord can change people's minds. And I've kind of changed my prayer in this regard from what can I say, Lord, to change their mind, to Lord, help me be quiet and help you to work in the hearts of the people, and especially our ministers and our pastors and our church leaders, that they will bring these issues up in the pulpit. And we'll start to speak loudly, just as our legislature has started to speak loudly about the right to life. And we're number 1 or number 2 or 3 in the nation. I hope our ministers and our pulpits and our churches will understand how important this is and understand they need to be number 1, 2 in our communities about proclaiming the right to life. Did I get there?
You got there. You got there. So let's talk a little bit about the Convention of States. I know that we've talked about that before we aired this. Just give us a little rundown on that.
Yeah, and I hope in this debate we can be respectful of one another.
Absolutely.
We've on both sides of the issue, people are very, very passionate. And sometimes we as legislators are really guilty of saying, we want to hear what you have to say, we want to hear what you have to say,
right.
And then you come and speak to us and we go, well, I'm not listening, or quit saying that, or I'm not going to answer your emails or your text. I think we particularly here in Craighead County are very aware of that. And I've had close friends and members of our committee on both sides of that issue. Of course, I'm a supporter of Convention of States, and we can argue the details of it, but folks, at some point, we're going to have to go to battle over this, and hopefully not with weapons, but discussing what the Constitution says and discussing what our plans are, because right now we have they announced $22 trillion in debt and escalating rapidly. Legislators who are in there for life, and we have a hard time pulling that back. The federal government now controls, I think, 65% of what Arkansas's budget is. Now think about that, folks. 65% of what we spend our money on, we have no say over. It comes from the federal government. And it's time we rein those kinds of things in. And the question I have for, and I've asked many people on the other side of the Convention of the States is, so what's your plan? What do we do when we see escalating debt at the rate that we're seeing, up to 22 trillion? We see politicians in there for life, and we can't pull back. We see our state government has very little power over what we do in education. All the education rule is governed by the feds, not so much by the state, because they control so much of the money that goes in. So if we don't do convention, what are we going to do? Because what we're doing now is not working. And one thing we know, when we keep doing the same thing, we're going to keep getting the same result. And I'm ready to try something different. And I have confidence in the people of Arkansas and in some of the people in the other states. But I have confidence in the people of Arkansas, and I have confidence in the people of Craighead County that we will stand strong whatever the issue comes up, and we'll fight for those constitutional rights in a convention, just like we fight for the right to life, just like we fought for our Second Amendment rights. But I welcome that battle. I welcome that discussion. It's what our nation was founded on, and I think as a nation, it's time to go back and allow those kinds of discussions to happen again.
Sure thing. Well, it's been a busy week last week, huh?
It has been exciting.
It has been. So, of course, now we have to look at the week ahead. And so if we had that much of a busy week in the state legislature, well, what's coming up?
Well, coming up particularly is what we in the legislature refer to as Scope of Practice Week for medical issues. Scope of practice is what a medical professional, what services they can and can't provide. So, folks, when you look across the spectrum of when you go to the doctor or you go to your ophthalmologist or you go to your dentist or whomever you see in that medical arena, those people all have an education. After their education, they have specific training. After they have their training, they have other courses they go through. They may have, I'm going to call them an internship. Even doctors have internships, but other professions have internships that they go through. So we call that the scope of practice. In Arkansas, as we are one of the most highly regulated states in the nation, and we're trying to turn that back. We're trying to have legislation go through now that opens all those regs up, particularly in the area of medical care. One of the biggest drivers of your medical care is regulation, that you're only allowed to see these certain people. You don't have much choice. And so this week we're going to hear scope of practice legislation. One of the biggest ones coming up is for advanced practice nurses. Advanced practice nurses go out here to ASU. They spend a lot of their money, 4 years in college. I think there's some after schooling they go to also. Then there's training that they go into, and after they graduate, they have a scope of practice. Well, when they graduate from ASU, we cut that scope of practice down in the state of Arkansas. There are things that they are not allowed to do, even though they were trained, even though they have experience. We don't allow them to do that. So I'm a co-sponsor of legislation that would expand that scope to allow them to practice to the full scope of their licensure. In fact, Jeff, at the veterans hospitals, they're federally funded. The feds allow advanced practice nurses a full scope of practice at the veterans hospital in Arkansas. So if you're at the veterans hospital, you have a broader scope than you have if you're at a hospital in the state. We've been fighting this. This is my third term. I've run this legislation 3 times. And folks, the Medical Society of Arkansas is very protective and literally spend hundreds of thousands of dollars to stop this. As a matter of fact, that's why I had an opponent. My opponent is a doctor who I think he said works with 20 advanced practice nurses. Some of his big supporters financially were people who have advanced practice nurses clinics around the state. He outraised me, I think, almost 3-1. We still won, and I'm thankful for that. But that's the level of investment that the Arkansas Medical Society, different from the medical board, the Arkansas Medical Society is willing to put hundreds of thousands of dollars into creating a hedge around their practice. I think there's 23 or 24 other states that allow advanced practice nurses to practice to a broader scope of their licensure, and there are levels of that. And Jeff, one of the things that you can see as a legislator, we have to protect people's health. That's one of our first responsibilities is safety. The other important responsibility is cost. What is the cost of that? So we are really risk managers. Manage the risk of cost, manage the risk of quality of care. So as a legislator, one of the things that I look at in all of these scope issues is what do the insurance companies say? We may not like them on some issues and think they get rich, but their goal is to manage risk. So when you look at what the risk is for an advanced practice nurse on expanding their scope, an insurance company would look at that and say, what's my cost as an insurance company? Are these quality providers? If not, I'm going to push their insurance way up. If you go to an advanced practice nurse, I'm going to charge you more because there's a higher risk for me as an insurance company. Folks, we don't see that. We just don't see that. We see the insurance companies as supporting advanced practice nurses. The risk can't be higher, or they would bump those costs up. And the costs actually go down for you when you see one. Folks, you may not realize this, but quite often you see an advanced practice nurse when you go to the doctor. And quite frequently, that advanced practice nurse can bill the doctor rate rather than bill the advanced practice nurse rate. This will save the state money. It'll allow us, and I have people in constituents in Monette and Caraway and Lake City and Black Oak that have senior centers. And I met with the chancellor at UAMS last week, and we talked about opening up smaller clinics in these senior centers around the state, where an advanced practice nurse, and one we'll talk about in a minute, telehealth, where we could set up telehealth stations. We can set up advanced practice nurses to go into our senior centers and actually bring care right into our communities. And folks, can you imagine the improvement in our smaller communities? There's a lot of people who live in these smaller communities. They love it there. I love it there. And they want to stay in those communities for a cheaper cost of living. That's where their family was raised. And there's no reason, given today's technology, that we can't start offering healthcare services in those kinds of centers and turn those senior centers and youth clubs and you name it, whatever, into health centers and revitalize what goes on in our communities. So I'm really excited about that. I kind of bled into telehealth.
No, that's okay. Go right ahead with telehealth.
Telehealth, I've run that bill several times, and we've expanded the telehealth opportunities in the state, and I'm excited about that. We have one last little barrier to remove is to allow you to call your doctor on your phone. Right now, it has to be by video conference like we're doing now, and phone also, tele and video. So this bill would allow people in the state of Arkansas to use audio only, which means if you're in southeast or west Arkansas and you don't have the internet capabilities, you can't Skype, this would allow you to establish that relationship over the phone. Now, folks, I know people are going, I don't want to do that. I don't want to do that. Fine. You don't have to do it. This bill doesn't require you to do this, nor does it require you to see an APN, but the telehealth bill doesn't make you do that. It's just if you choose to do that. And the providers of these services have protocols. So when I'm talking to you and we're on the phone and we're listening to what's going on, at some point the doctor is going to say, this teleconference needs to end. This is not what you need. You need to come in and let's work on that. The doctors are all licensed in Arkansas. They may live in Tennessee. They may live in other states, but they're all licensed in Arkansas. And folks, guess what this does to your cost of medical care? It drives it down. You've got a child, you're getting ready to take them to school in the morning. They've got a cough or a cold, or maybe you do, and you're having trouble getting in, staying home from work, and you, instead of driving to your doctor's office and they know you and they see you and you get a prescription for that, you can do it over your phone. You can do it Skyping. You can do it over audio. Again, it's just another source that we have an opportunity to do this. And you know where we were when I first ran this 2 years ago?
Where were you?
We were 49th in the nation.
Wow.
In telehealth. Folks, we've made great strides. This will get us up to being number in the top 10. Just this little glitch alone is a barrier that prevents access to care. And the great thing about these scope of practice bills, Jeff, is you get to choose. You know, this doesn't force anything on anybody. Again, we call it liberty and freedom.
So this isn't like the Affordable Care Act where President Obama said, if you like your doctor, you can keep your doctor. It's nothing like that, right?
Nothing like, just the opposite. Just the total opposite.
Okay.
You know, this is, you have the choice of freedom, and he lied to you when he told you that, because that wasn't in the language. The language this time is freedom language, and it tells you have a choice.
Absolutely. Well, see, I mean, across Arkansas, and of course you talked about rural Arkansas, where of course our healthcare needs are drastically under what they well, the needs are far greater than what we're able to provide right now. And
well, in fact, we're able. The medical society and other groups choose not to.
Okay.
So it's, again, I don't think it, and then certainly some of that access to care is a ability, but the ability is far greater than what we're allowing at this time. So we're trying to expand those scope of practice issues and allow people to have a choice to do that.
Sure. Well, and still yet they're underserved. So like you said,
absolutely. And we're
them.
to that point, I met with UAMS chancellor and 4 administrators last week. And of course, we have a UAMS branch right here in Jonesboro. Mm-hmm. And the chancellor, our president, I apologize, I forgot the title, drove to Little Rock to meet with us, our 4 local legislative reps, and talk about what we can do here in Arkansas to expand access to care. Mm-hmm. And of course, my comment to him was the same. Help us get access to care to our rural communities. Help us get to Lake City. Help us get to Monette. Help us get to Caraway. Help us get to Black Oak, and provide that quality care all around. Mm-hmm. And then partner with businesses who are they're the providers scattered around, whether they're these clinics we have around the state and around our county, to work with disabled children, to work with disabled adults. Partner with those people so that we can provide that quality care that all of us desire at a cost that's much more affordable. Because, Jeff, we are spending far more than is necessary if we can extend those scope of practice issues, if we can develop partnerships. We can greatly reduce the cost and greatly improve access. Mm-hmm. And I'm excited about those things.
Good deal. I am too. Now, so let's talk a little bit about and I'm going to butcher saying this, but the optometrist and ophthalmologist.
You did a good job.
Did I?
Yeah.
I'm glad.
Yeah. As far as I know.
Try spelling that.
Again, this is a scope of practice issue that the optometrist want to perform services that are currently corralled by the ophthalmologist. And I don't use that word corralled in a negative sense, but that's essentially what has happened, that they have services that they perform that this optometrist can't. The optometrist has specific training to do the services that this bill would now allow them to do. So it's not like they didn't go to school to do it. It's not like they didn't have special training to do it. They've gone to school to provide this. They have the special training to provide that service. And that is a limited service that they want to provide. Oklahoma's doing it now successfully. And I actually asked for what the insurance rates were in Oklahoma for this, because if this scope of practice were in place in Oklahoma, and they were having a lot of bad things happen, first thing you'd see is Oklahoma saying, we're out of there, we're not going to allow this, we're going to roll that legislation back. Oklahoma's not doing that. Oklahoma says it's working. The second thing you'd see is insurance companies would be bumping up the insurance rate for the ophthalmologist, because you guys, not you personally, but those ophthalmologists over there are actually making a lot of errors. Well, they're not. We're not seeing any increase that I'm aware of in what the insurance rates for those folks are. In fact, they're charging, I think, less than what happens over here in the ophthalmology arena. I'm not sure about that. I have to check. But at least it improves access to care and opportunities for care. And when you have a competitive market, what generally happens when you have a competitive market? Costs go down.
Yeah.
When people say, well, I've lost some of my patients over to those folks, and I'm going to have to drop my rates, or maybe open for longer hours, maybe open at 7 o'clock, maybe stay open till 7 p.m. But they're going to have to adjust their competitive model to do that. So as a legislator, again, I see my role as very much of a risk manager. What's the cost on the side for the patient? Does it cost you more? Does it cost the state more with Medicare or Medicaid? And then what's the risk to the safety of our people in our state? Because that's a primary obligation that we have. When I look at those, just like an insurance company does, I see that this is a good thing to expand that scope, and I'll be supporting that. And of course, if any of our listeners have any questions or viewers have questions about this, I'd be glad to discuss it with them. And also welcome to, if we have 5 or 6 people, just get them together and let's have a conference call, or I'll come back to Jonesboro. I'll be here Thursday night to hear Chris Ann Hall.
Okay.
I think is going to speak here on the Second Amendment. And I'll be here to hear that Thursday night and be glad to meet with any of our viewers and about any of these issues.
Sure thing. Well, Dan, it is so good to have you here. And anything else that you want to tell us?
No, just how much I appreciate what Jeff is doing here. We need to give him some credit for coming up with this idea, because we need to get the word out and we need to engage people. And we as legislators have an obligation to let you know how we vote. I'll tell you this, as a viewer, I would watch legislators who vote present or don't vote. We have an obligation to vote. We have an obligation to take a position and then to stand behind that position. So you watch us, and when we're not voting and we're voting present, we're not doing what you sent us down there to do. You sent us down there to represent you. That means taking a vote on as many issues as we possibly can. So I appreciate what you're doing. Great job, and look forward to seeing you again sometime, and
Sure.
Look forward to seeing all of our viewers out there on the road.